Hello, my friends. This is Dr. B, the best doctor in medicine. Today, Dr. B wants to talk to you about this blockage that you might have in your heart, but you don't even know about it. Isn't that crazy? In medicine, the term blockage, we call that obstruction. You might have an obstruction in your heart and you don't even know it until what? Until a heart attack occurs. My dear friends, whether you're a woman or a man, Dr. B is here to help you age gracefully and to stay away from cardiovascular disease, heart attacks, cancer, strokes, kidney disease, liver disease, blah, blah, blah. The number one cause of death all over the world, the number one cause of death is cardiovascular disease. And at the top of that, you have heart attack. Heart attack kills every year millions and millions and millions of people all over the world. The number one cause of death in humans is heart attack. Number two is, of course, cancer. Now think about that. One important statistics, 50% of heart attacks occur without the patient even knowing that he or she had heart disease. Think about that. The number one cause of death, listen again, the number one cause of death in mankind is a heart attack. Number two, cancer, right? 50% of people who have a heart attack didn't even know that they have a heart problem, heart disease, before that. In medicine, we call that an inaugural event. Inaugural event means it's a shocking event that happens for the first time without the patient even knowing that he or she had any problem before with the heart. 50%, half of the heart attacks, guys, happen as a primary inaugural event. The guy felt pretty good. He's 40, 45, 50, 55, 66. Oh, maybe he has a little bit of high blood pressure, a little bit of diabetes, high cholesterol, smoking, diabetes, alcohol, socially. They always say socially. I mean, what does that mean, socially? All my patients, when I ask them, 99.9% of the time when they drink, they never tell me I drink too much. They say I drink socially. Well, what does that mean, socially? Is that one glass per day? Is it a big glass or a small glass? Is it 2 tequilas and a whiskey? What the cazzo does that mean when you say socially I'm drinking? Doesn't mean nothing. Doesn't mean anything. Alcohol should be zero drinking, zero. So the guy feels pretty good, goes to barbecues, is married, the wife, the kids, or the husband, the kids, the family, life is good, work and everything. And suddenly, while he's at work, or he's watching TV with his wife, or he's having dinner, or he's having sex, right? Suddenly a heart attack occurs. My God! That's why the partner, the kids, the family, everybody call 911. The guy has passed out usually. Usually they pass out, right? Sometimes not, but usually. And that's it. 911 comes, takes the guy to the hospital. They try everything. He dies or she dies, or they try everything, but the guy is such a disastrous situation, goes into heart failure, they need to do emergency surgery, bypass, blah, 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 or removing the clot. I mean, I don't want to go into the medical part. That's not the point. My channel is for the average person like you, Jane, like you, Joe, who are not knowledgeable about medicine, who are enjoying their life, their work, their family, right? I'm here to help you age gracefully. Listen to Dr. B. Follow my recommendation. Watch my videos. and look at them, watch them, follow my guidance, follow my recommendations, so that we can together, me and you, age gracefully and be together in 50 years, God willing, right? 50% of people who have a heart attack didn't even know that I have a blockage, an obstruction, a blockage in the two arteries. There are two arteries that feed their heart. Two arteries. They didn't even have any clue about that. That one of the two arteries, or two of them, had a blockage, an obstruction. And until in half of the time, 50%, a heart attack occurs. In the rest of these people who have a heart attack, many of them, half of them, knew that they had heart disease and coronary artery disease, a blockage, blah, 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 blah. But 50% of them, it happens as a surprise. We call that a first inaugural event. And that's a shock for the patient and the family. The patient might be dead, so the guy doesn't have the time even to react. When you have a massive heart attack, which is usually the case, you have just a few seconds, you feel really bad, you are nauseated, you vomit, you have chest pain, sudden chest pain, you feel dizzy, right? Shortness of breath, blah, 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 and then you pass out. That's it. If there's nobody to call 911, you're done. Even if 911 come, they try to save you right there. By the time they take you to the hospital or the ambulance, you're dead already, right? So these people didn't know they have a coronary artery. The arteries, the two arteries that feed the heart, we call them the coronary arteries. There are two. The right coronary artery and the left main stem coronary artery, right and left. So they have an obstruction, they didn't know it, and that's it, the heart attack occurs. Now you, my fellow citizen, whoever the catso you are, how can you know that you have an obstruction in your coronary arteries? Well, you need to go see a cardiologist, right? Your family doctor doesn't know. Your family doctor doesn't have the knowledge, the skills, the medical intuition, right? To understand that you are at high risk of having coronary artery disease. Only a specialist like Dr. B at a cardiovascular clinic where we have dozens of cardiologists knows that you are at high risk of having one or two of the arteries that feed oxygen and blood and nutrients to your heart. One of them is obstructed. Meaning instead of being nice and open, you see two of them, look at them, they are nice and open, blood can go, right? One of them is very tight, narrow. Or two of them are very narrow. Think about that, having the two of them completely or partially obstructed. It's a disaster, right? It's a disaster. You're just waiting to die suddenly at home, at work, during while you are walking your dog. I mean, how crazy that is, right? And it can happen starting at the age of 40, especially if you have risk factors, right? So my friend, please, get in charge of your own health care. Don't trust 100% your body, your mind to your doctor. Your doctor is a human. He's busy making money. He's busy running his clinic, right? He has dozens of patients every day, 30 patients in and out of the room. He doesn't have the time to think to individualize the health care, his medicine to the individual patient, right? We call that tailored medicine, tailored healthcare, individualized medicine, individualized healthcare. But they don't have the time to do that, so they put everybody in the same umbrella, right? Modern medicine should be individualized, tailored medicine. Means every patient should be looked at differently. But that's not the case in modern America, because modern America's medicine is going down the drain, right? There's 350 million people. So we have a huge population. Remember, we are the third most populous country on earth. We have 350 million people. Our national debt is at $37 trillion, which is increasing every year by 1 trillion, not million, not billion, trillion. Every state is bankrupt. They have huge deficits. I live in California. Millions of people don't have insurance. Even those who have insurance, they don't have access to preventive care. So they have diabetes, high blood pressure, blah, 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 and they have nobody to see them, right? The guy dies of a heart attack, stroke, and nobody cares, right? Do you think the government, whether state government or federal government, cares about you? Of course not. They care about their power, their glory, the money, the privileges that they have, right? They live in these big mansions, they drive Ferraris, Lamborghinis, they have this private jet, right? Private jets and mansions, 20-bedroom mansions with swimming pool. What the katsu do they do with it? I never understood. What do you do with a 20-bedroom mansion? And I don't get it. Anyways, so get in charge of your own health care. Don't trust everything 100% in the hand of your doctor. He's busy. He has a ton of patients to see. Have you noticed how at the hospitals and clinics, the family doctors, the internists, they go in and out of each room, right? You spent an hour in the waiting room, but your doctor sees you for only 5 minutes, right? Quickly. Doesn't even answer your question, doesn't have the time. There's not many times these poor people, whether Asian or Latinos or any other language, there's not even a translator, right? To translate correctly for them. The guy doesn't understand what is this doctor saying. In and out quickly. Just look at the file, results of the blood test, get out of here. But you should have sent that poor guy to a cardiologist to screen for an obstruction of these two arteries, right? So that the guy in 2 years or in 1 year or 6 months doesn't develop a heart attack, right? 50% of them, they don't even know that they have a heart, that they had a problem with their coronary artery, that they were completely clogged or obstructed, right? Because nobody sent them to a cardiologist. So guys, my dear fellow citizen, do not trust 100% your doctor. Get in charge of your own health care. Be knowledgeable, and Dr. B is here for you. My channel, guys, is not about teaching doctors, other doctors or medical students. I used to teach actually medical students, nursing student, ultrasound student, x-ray student, MRI students. I don't have the time anymore. I work 8 to 10 hours at the clinic. I'm so busy, you cannot imagine. I have to give up teaching. But now you, the average Joe, the average Jane, and I say that very respectfully, who don't have any knowledge about medicine, you are my new students. You are my classroom. All of you who are watching me. And I love it because now I am back as a teacher in healthcare, in medicine. You are my students. Watch my videos. Follow my recommendations. Watch what I'm telling you to do. Do it. Next time you see your family doctor, ask him or ask her, doctor, listen, you have never sent me. I'm 50 years old. I'm 60. I'm 65. I'm 70. You have never sent me to see a cardiologist. Please send me to see a heart doctor, heart specialist. Oh, but you don't have any problem. I don't see any reason to send you that. Your heartbeat is regular. Your blood pressure is controlled by my medication. Blah, blah, blah. But the family doctor, the internist, they don't understand this kind of things. He's not a heart specialist. So there's so much the guy knows, right? He's an internist, he's a family doctor, he's not a specialist. He doesn't understand the heart, the blood vessel, the cardiovascular system the way Dr. B understands it, right? So insist, be polite with your doctor, insist, be friendly with your doctor, but insist, doctor, please. I have never been to a cardiologist, and I've had this blood pressure for so long, this diabetes, this high cholesterol. I was a smoker. I'm a drinker, even if it's socially. Please send me to a heart doctor. Insist, right? And I mean, he needs to send you. If he doesn't send you, guys, you need to call your insurance company and get another family doctor, because it's inacceptable or unacceptable that is somebody who is 50 or above will not be sent to a cardiologist for a screening, right? We need to not wait until a catastrophe happens before they send you to a heart doctor. You don't wait until your wife has breast cancer, right? You have to do yearly mammograms after a certain age. You don't wait to go see your urologist once they have diagnosed you with stage 4 prostate cancer, right? You need to go see your urologist every year starting the age of 55, right? Even if you feel okay, I go see my dentist. You see my dentist? Nice, beautiful, clean teeth. Do you see that? My teeth? Beautiful teeth. I go see my freaking dentist every 3 months, right? Recommended is every 6 months, but I go even every 3 months, right? Because make sure there's nothing over there, right? Tiny stuff starting. Make sure my teeth are clean. We don't go to the dentist once we have a big, huge cavity and the tooth is starting to hurt and blah, 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 right? And we have an abscess, right? It's the same thing for your heart. Don't accept when your regular doctor says, oh, but you don't need it. What do you mean you don't need it? I'm 50 years old. I've had this and that and this and that. And even though my blood pressure is controlled, even if my diabetes is controlled, I am obese, doctor. I am overweight, doctor. I have risk factors. You need to send me to see a heart doctor so that I don't have a heart attack. One of those 50% inaugural heart attacks. I saw Dr. B on YouTube. Show him my videos. Tell that family doctor about what I just said in this video. Show him the video. If he doesn't send you to a cardiologist, then my friend, you need to make the decision. There are dozens and dozens of family doctors and internists out there. They are not specialists, so they don't understand what I am telling you right now, right? It is your health. The day you're going to have a heart attack, that family doctor not going to care. That family doctor, right, he has what we call professional liability insurance. It's like my car, right? I have insurance. So if somebody bumps in me, I don't care. If I have an accident, I don't care. The insurance is going to cover it, right? It's the same for that family doctor. He doesn't give a cat. So the day you have a heart attack because he didn't send you to our beautiful, great cardiovascular clinic, the day you have a heart attack, he's not going to care, right? You're not going to care. He has liability, professional liability insurance. Even if you sue him, nothing happens to him, right? Because the insurance, liability insurance, is going to pay the money that they're going to settle with. But by that time, you'll be dead, or you're going to be such a mess in severe heart failure. You're going to have to wait for a heart transplant, right? Your life is gone. Your life is gone. You don't want to reach that level, that extent, that time, right? So be polite, be civil with your doctor, but insist, right? Ask your doctor to send you. And if he doesn't, call your insurance company, switch doctor, right? You're not happy with your landlord, you move somewhere else. You're not happy with this restaurant, I eat at another restaurant. You're not happy with that nail salon, you go somewhere else. You're not happy with this dentist, you go see another dentist. It's the same for family doctors, right? Don't put them like the guy is a king. No, he is human and he has his limit. He has his limit in terms of knowledge. He has his limits in terms of skills. He's not a specialist, and he has his limits because he's seeing so many patients. He doesn't have the time to provide you with individualized medicine, with individualized tailor-made medicine that would be good for you. No, he doesn't have the time. He put all his patients under the same umbrella. He treats them the same. He gives them the same medicine, blah, 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 blah. right? Guys, Dr. B is here to help you so that me and you, can age gracefully together. Because I love you. Dr. B went into medicine more than 30 years ago. More than 30 years ago. And I still remember day number 1, guys, as if it was yesterday. How time passes. Dr. B loves you. Dr. B didn't go into medicine for the money, the glory, the fame. I swear to God. And I love you regardless of your gender, your ethnicity, your race, your politics, your religion. I don't give a cat. So if you're a human being, I love you as much as I love medicine. And I will never retire from medicine. And God willing, I will keep doing medicine at my clinic for the next 100 years, for the next 50 years, until I'm 100 years old. Right now, Dr. B, 50 years young. In 50 years, hopefully we will still be together. Put your comment, your question down there. I promise I will get back to you. It might take some time because I'm so busy with the clinic, 8 to 10 hours a day. I work including Saturday, plus go to the gym 2 hours a day, plus I have to sleep 9 hours a night to be fresh and healthy in the morning. And I have to study 1 hour a day, the medical journal that I receive every week, so that I can stay in touch at the top of my knowledge and skill and stay the best doctor, doctor number 1. This is Dr. B. I love you. I hope to talk to you next time. I give you a big hug. See you in the next video. Bye-bye.